What if the solution to a problem you might have can be found within what is already working well in your life? Family Solutions Institute here again, and today we're looking at solution focused therapy, a brief, strengths based model that helps clients notice what's already working and build toward their preferred future. Solution focused therapy, often called solution focused brief therapy, or SFBT, was developed in the late 1970s and 1980s by Steve DeShazer, Insoo Kim Berg, and their colleagues at the Brief Family Therapy Center in Milwaukee. The model grew out of the brief therapy movement and was created as a practical, respectful, and efficient way to help clients identify what is already working in their lives. Instead of spending most of therapy analyzing the origins of the problem, solution focused therapy asks clients to imagine preferred outcomes, notice exceptions to the problem, and build on existing strengths. The theory of dysfunction in solution focused therapy is not centered on deep pathology or hidden causes. Instead, problems are often understood as being maintained when clients become stuck in problem focused language, repeated failed solutions, or a belief that change is not possible. A family might come into therapy saying, "We always fight, nothing works," or "This will never change." The solution focused therapist listens carefully for moments when the problem is less intense, absent, or handled differently, because those exceptions can reveal pathways toward change. The theory of change in solution focused therapy is that small, meaningful changes can lead to larger shifts. Change happens when clients clarify what they want, recognize resources they already have, and begin doing more of what works. Common interventions include the miracle question, scaling questions, exception questions, coping questions, and identifying signs of progress. The therapist uses the client's own language and goals, making the process collaborative and future oriented, rather than expert driven. For MFT students and clinicians, the key takeaway is that solution focused therapy is strengths based, brief, collaborative, and goal oriented. It does not require the therapist to fully understand the entire history of the problem before helping the client move forward. Instead, the therapist asks, "What will life look like when this is better? When has the problem been less powerful? And what is already helping, even a little?" This makes solution focused therapy especially useful for clients who need hope, direction, and practical movement toward change. For more information on solution focused therapy and other important MFT models, visit FamilySolutionsInstitute.com. Pass the AMFTRB exam with confidence.